my presentation, I took the example of a 35 years old male who complained of muscle disease on the lower limb, proximally, and he had no relevant past medical history, nothing special otherwise. And I started by doing the age classification. So he was 35 years old. So of course you are going to focus on the adult and the adult cause basically. Then I continue with the genetic or acquired classification. And so the thing is to ask your patient if it has any family history about other people in his family complaining of muscle disorder. And in the case of my patient, her sister was also complaining on muscle weakness on the lower limbs. So based on that, of course, the usual things to do is to get the sister also in your clinical consultation, do the clinical examination, and eventually ancillary testing to go further into the diagnosis. And if you have a genetic clue, hereditary clue, so it might be genetic, then you must of course go into the ancillary testing, and then ancillary testing is the genetic testing. So then we tested our patient based on the phenotypical classification. So he was complaining of limb-girdle muscle weakness. So we did the panel for this condition, and we finally found out that it was a calpainopathy. So LGMD, so limb-girdle muscular dystrophy, caused by a mutation in the calpain gene.